This is one episode of a three-part series based around education and information for school-based telehealth. To see the other episodes, follow the information in this video's description. This series of videos was designed to provide educational content for federally qualified health centers and rural health clinics to assist with their telehealth implementation. The content is also useful for other types of providers and organizations. The following video will cover these specific topics.
Thank you so much for having me here today. I'm really honored that we're featuring school-based telehealth care and having the Alliance here. And I'm really excited in particular for you to hear from programs happening in the field where they can really give you some ideas of what's happening in the school-based world and answer your questions. So just briefly, I just want to let you know I'm with the School-Based Health Alliance, and we are a national organization that represents school-based health care. And what we'll be talking about today, hopefully many of you are familiar with the concept of a school-based health center, but if you are not, that is a lot of the examples that we will be talking about today. So within the school-based health care world, one of the primary models are school-based health centers, and that is a formal commitment between a school and a healthcare organization, and the healthcare organization provides comprehensive care to the students in that school, sometimes in person and sometimes via telehealth, like we'll be talking about today. So I just am going to give you a quick landscape of what we've been hearing at the Alliance from across the school-based telehealth field, and then, like Philip mentioned, we'll dive into two programs that are happening in the field. So I'm just going to share a little bit about what was happening pre-COVID-19 related to telehealth. So at the Alliance, every 3 years, we collect something called our Census, and we've been collecting that since 1998. And our most recent census was in the 2016-17 school year, and we found a little over 2,500 school-based health centers operating across the country. These are the ways that we define school-based health center delivery models. And the most common is a traditional model where care is happening on site in a fixed space on the school campus. But then you also see in the last column that we found in 2016, 2017, telehealth was becoming fairly prevalent with school-based health centers. So that last column is showing you that 11% of school-based health centers were operating via telehealth 100%. So the care was being delivered to students 100%. Back to that first column with the traditional school-based health center model, the traditional happening with the students on campus can also include a hybrid version of care. So some of the school-based health centers in that 81.7% of the first column were including some telehealth in their work. So both the first column and the last column are two primary places where we were capturing where telehealth was happening. Relevant to you all on the call today, we know from our census that more than half of school-based health centers are sponsored by, that means the healthcare organization operating the healthcare for the students. So we know that more than half of them are operated by FQHCs or lookalikes. Okay, so also at the time of the census, we took a little dive to pull out some of the telehealth figures and wanted to share a little bit of that with you today. You can see here that at that time, 20% of school-based health centers had at least one provider available via telehealth, and 36% of those traditional school-based health centers in that first column I showed you on the other slide that were using some telehealth in a hybrid model were sponsored by federally qualified health centers. And in that last column with the telehealth exclusive care, none of those were being operated by FQHCs at the time. Okay, this chart is just to give you a little sense that among all SBHCs, and that's short for school-based health centers, the most common type of telehealth provider was a primary care provider at the time of this census. And then the next most common was a behavioral health care provider. So I do want to make a plug for all of you on the call today and your FQ peers across the country that we know that looking at our census that there were 33,800 schools across the country that both did not have access to a school-based health center and where 70% or more of the students were eligible for free and reduced lunch, which is the proxy we tend to use for lower income families and potentially on Medicaid. So we know that there's room for a lot of growth for more school-based healthcare being delivered at schools. We also know that although federally qualified health centers were operating the most number of school-based health centers, that was only about 20% of the whole field of FQs and lookalikes of health centers. So there's still 81% of FQs out there and lookalikes who are not doing school-based healthcare work. And then we also took a look at the county level. And if you look at that last number, you'll see that 1,383 counties across the country have FQs, but again, they're not operating a school-based health center. So all of those data to say, if you're considering offering school-based healthcare via telehealth and are not currently doing so, you can see there's definitely a need for both in-person and telehealth care to increase access for more students at school sites. Okay, now I'm just going to give you a very quick glimpse of what's happening since the pandemic. As you can imagine, school closures across the US due to COVID forced a lot of school-based health centers to pivot to telehealth immediately. And now more than ever, we're finding the school-based health center field shares a desire for support in telehealth startup and operations. And that's where we're trying to offer a lot of help in collaboration with other partners across the country. So in the early spring, we held some listening and learning sessions for the school-based health centers just to find out what they were doing and to share with each other some best practices in the time of COVID. And we found, as no surprise, that many were launching telehealth as some of their services and expanding that scope of care. Many were also starting to involve parents and guardians as telepresenters if they were delivering their school-based telehealth care with students in the home. So we've started to hear different versions of telehealth happening with students, both with the student at home or the student at school. Also, we've been operating for several years, our National Quality Initiative. Within that, we run cohorts of collaborative improvement and innovation network cohorts where we're doing quality improvement cycles related to some primary care clinical measures. And you can see here, we're actually, with our new cohort, we're starting to add in measuring and helping the field with quality improvement related to telehealth care as well. And so we've started to capture, both from the listening and learn and from some of these sites that we're starting to work with, some of the innovations that we're hearing. And we just want to show you that we have a playbook online that aligns with that National Quality Initiative that captures some best practices and tips from the field. And so you can find some of what we're hearing from the field about how people are innovatively offering telehealth services to students in school and at home. Just a couple of highlights here to show you what we have been learning from the field. You can see some of the telehealth innovations we're hearing related to depression, and depression screening is one of the quality measures that we're working on. We've heard about school-based health centers at the beginning of each session confirming the location and callback number of students when they're at home, so that if necessary, the clinician can send help if needed. We have seen caregivers engaged in helping to screen for depression. As I mentioned earlier, sometimes the parents and caregivers are helping as a telepresenter. And we also have heard some clinicians saying at the bottom here, seeing students at home can actually help provide some additional insight into depression symptoms. You can see what's happening in their surroundings. Some mentioned if you see a student who can't get out of bed, that can give the provider more information about functioning. Okay, so a lot of these you can find again in our playbook, but just to call out here, you can learn some more telehealth practices that are happening in the school-based field. Here, we've heard a lot of school-based health centers are providing program overviews to their key stakeholders to get buy-in, reaching out to students and families proactively to let them know that they're there and available via telehealth, and even prioritizing certain subpopulations of students who might be due for care to reach out and schedule them for telehealth visits. Okay, and then just lastly to show you, we ran a survey this summer of school-based health centers to collect a little bit of data on top of the listing and learn qualitative information we got in the spring. And we got about 20% response rate. And we found, again, to no surprise, that telehealth is a major strategy school-based health centers are using now and plan to continue using in the future, even when in-person care returns. Many plan to have a hybrid version of in-person and telehealth care. And you'll see a publication coming from us very soon disseminating data from these findings. And then lastly, to let you know, we are going to put out this spring a school-based telehealth resource guide. And this will talk a lot about startup and implementation operations for those who want to start up and deliver care to students via telehealth. We're collecting, again, from a lot of experts across the country and what sites like you're going to hear from are doing, and put it hopefully all into one place to make it easy for those like you who are on today.
This series of videos is presented to you by the National Consortium of Telehealth Resource Centers, the NCTRC. The NCTRC is funded through the U.S. Department of Health and Human Services, the Health Resources and Services Administration, and the Office for the Advancement of Telehealth. This map represents the NCTRC, which covers the whole United States and includes 12 regional TRCs and 2 national TRCs, which are the National Policy TRC and the Telehealth Technology Assessment Center. The TRCs have been in existence since the early 90s and were established to provide assistance, education, and information to organizations and individuals seeking information on providing healthcare at a distance. The NCTRC mission is to expand availability of healthcare to underserved populations through telehealth. For more information about telehealth, the NCTRC, one of the 2 national TRCs, or your regional telehealth resource center, please contact us through the NCTRC website. Thank you for joining us in reviewing this video series.